Hello, Mr. Pearson. I'm Eric Stedman. I'm a student physical therapist. So today we're going to be doing an evaluation with you. I know you have had some issues with your ankle. And along with that, we're going to do a history. I'm going to be asking you some questions to get some background information to help us figure out what we can do to help you out. Is that all right?
Yeah.
Okay. So tell me what happened. What brings you in here today?
Alright, so I broke my ankle a couple years ago. I was playing softball, slid into third, and it snapped, and had to have surgery. And it's just been really stiff over the last 2 years, and haven't really gotten any better.
Wow. What kind of surgery did they do? What did they do in that surgery?
I had a trimalleolar fracture, and they had to put a plate and 9 screws in there to try to put it back in place. It was actually like pointed out, like probably straight out the side of my leg there.
Super painful, I bet.
Oh yeah, worst pain I ever felt.
You see you have a plate and 9 screws in there. So what do you still have going on in the ankle now? What are you feeling? What's going on there now?
So the main thing is that it's really stiff. It doesn't bend very well or move, and so it kind of limits some stuff I do, and it'll swell towards the end of the day. It's a little swollen right now, but that's really about it.
So does it swell like that at the end of every day?
Yeah, like every day it'll be probably about almost close to twice the size of my left one, but when I wake up in the morning it'll be back down to normal.
Okay. So along with the swelling, is there any pain?
The only time I really ever have pain is when I'm like trying to bend it up, because that's the thing that's most limited. And I get pain kind of across the front of my ankle right there.
Okay. And is that where it's most stiff too, that same motion, bringing it up like that?
Yeah,
That's
really all I got.
Okay. Do you take any medications currently, either with the pain or for any other conditions?
No pain medicine whatsoever.
Do you have any family history of any heart disease or cancer or anything like that?
I had an aunt that had cancer, had breast cancer, and then both my parents have high blood pressure and are on medication for that.
Your blood pressure is normal though?
Yeah, they tell me it's like on the cusp of being high, but not too terrible yet.
Okay. And then, so the next part with that, along with what we've been talking about, how does that affect your daily life? Anything from home to work?
So at work I sit a lot, and like I'm up and down a lot, and so like if I sit and I'm writing a lot or typing a lot, and I go to stand back up, the first few steps I'm pretty gimpy, but once it loosens up a little bit, it usually feels okay.
So do you feel like you're gimpy because it hurts, or because it's stiff, or both?
It's more because it just won't move, and it's really stiff. It's a little sore when I first stand up and put weight on it and walk, but usually it's just because it's stiff.
Okay. All right. And then what about at home around the house? Do you have any stairs in your home?
Yeah, I've got about 15 stairs. Going up, I'm doing pretty good. Going down, I have to sometimes I like turn sideways and kind of go down sideways, just because like if I try to go down normally, I can't do it.
It just feels too stiff.
Mm-hmm.
Right.
Yeah.
All right, that makes sense. Is there any other activities, sports, or anything at school, or anything else in your life that it affects?
Sometimes if I like try to jog or run or jump, it'll kind of hurt a little bit, but not too bad.
Not too bad. Okay. All right. Along those same lines, what are some of your personal goals that you would like us to help you with, that you would like to be able to do better?
I mean, biggest thing is I just want it to move better. I would love to be able to play sports again, but I don't know if it's even possible or to try to do that again. But mainly, biggest thing is the stairs, going down the stairs, because that's on a regular basis. That's the only time I have problems, and so if I can get it better with stairs, then I'll feel better.
Perfect. All right. I agree. I think if we can work on increasing the motion, getting rid of that stiffness, that should help with the stairs. And that's a good end goal to have, to be able to maybe jog again, work your way back into sports. We'll do what we can there. All right. The last thing is, can you think of any other personal factors or anything else that might affect your therapy treatment, or anything else you want us to focus on that we haven't already discussed?
Not that I know of.
All right. Okay, so now we're going to do some tests to kind of assess some things. You mentioned it feels really stiff. So the first thing we're going to do is we're actually going to measure your ankle range of motion. You said it's mostly stiff just in this direction, right? Just
Yep.
pulling it up towards you.
That's the one I noticed the most.
Okay. So I have this little tool here. It's going to measure the degrees of motion you have in your ankle.
Okay.
So could I have you put your legs up there on the mat there? Come on over. Okay, so we're going to test this on this leg first. Do you have any tightness back here in that muscle?
No.
Okay. So go ahead and bring that towards you as far as you can. Any pain?
Nope.
Okay. I'm just going to measure that there. Lift it up just a little bit. You going a little further? There we go. Alright, good. Almost 15 degrees. Normal with that is 15 degrees, so pretty good there. Alright, now we're going to measure on this side. Okay, we're going to do the same motion. Curl your toes up. Alright, about 1 degree. Okay, we're also going to test this with the knee bent just a little bit. See if that improves it. If this muscle here is tight, that can affect it. Okay, so do that same thing. Yeah, about the same. Okay, so definitely there with that test, we can see where you're lacking in that. It's called that dorsiflexion. That's that motion there. I'm sure you're familiar. So we can work on increasing that. We can do some stretches, hands-on therapy, stretching it out, increasing that range of motion. That's going to help with the stairs, help with the stiffness when you're at work. After you sit down, you get back up. It's going to help it move better. Okay, so the next test we're going to do a manual muscle test. So let me show you first. I'm going to have you stand up. You can hold on to this to help you balance. You're going to stand up on your toes and back down. Just lift that heel up. Okay, so if you can do it 10 times without getting too tired or without any pain, then you have normal pain or normal strength in these muscles back here across your ankle. Once again, so the reason we're going to do that test, that's going to show you're going to be able to walk functionally, walk normally, and it's going to help you with the stairs as well. Okay. So if it hurts, then you go ahead and stop, or if you just feel too tired, you can go ahead and stop.
Okay. Am I allowed to like death grip the couch?
No, just 2 fingers on the couch. That's 5,
I don't have good balance either.
6, 7, 8, 9,
Calf starting to cramp on that.
10. Good. That's all you gotta do is 10. So you have normal strength in that calf muscle. A little bit of cramping, so we can show you some stretches to help with that. So the range of motion's impaired. It gives us a goal to work on that range of motion. Your strength showed normal, at least for that muscle back there. Maybe next time when you come back we can test some of the other muscles to make sure you have normal strength through all those ankle muscles as well. Okay. The last test we're going to do is more of a functional test. We're going to do some stepping down. You said that's what's the hardest, right? Going downstairs?
Yep. Yeah, that's definitely the most limited.
Okay. So we have a step right over here. Come on over. I'll show you what we're going to have you do. So it's actually going to be harder going down with your stronger leg. So you're going to step down with that left leg. Try to keep that right foot kind of flat and just kind of normal stepping down. And I'm just going to observe your motion as you step down. You can feel that heel pop up, right?
Mm-hmm. Yeah, I feel like I'm just kind of like falling down.
Any problems going up on that? We'll do it one more time. I'm just going to watch that heel. Try and keep it as flat as you can. Any pain when you do that?
I get a little bit like across the front there.
Across the front there. Okay. All right, let's have you come back and sit down. Awesome. Okay. So we have some things to work on. We can do some hands-on therapy, manual therapy, some good stretching exercises, and some things to help with the swelling, some education, some things we can teach you and work on. Now, do you have any questions about anything we've done here today?
Nah, not really. I mean, it's kind of aching right now.
Okay. We can get some ice on there. Get your leg, get some ice on it.
Okay.
And would it be all right if we had you come back about 2 times a week for a couple months? We can try our best to stretch that ankle out, get the swelling down, get the stiffness down, see if we can help you a little bit.
Yeah, I mean, I'll try to see what I can do on my schedule, see if I can come twice a week. Do you think if I came more that it would get better faster, and I wouldn't have to come for 2 months?
Maybe. You've had it for 2 years, right?
Mm-hmm.
So at this point I want to do more of education and show you some things you can do at home and every day on your own to help you get better.
Okay.
So we'll start it twice a week
Okay.
going forward. Okay.
All right.
Any other questions?
That's all I got.
Okay. Well, good. Nice to meet you.
Just me and you too.
See you next week.
Thank you, sir.